Hello everyone, my name is Will. I am one of the nuclear medicine physician in Thailand. And recently my friend asked me about the use of testosterone to boost his muscle. First I had no idea what he was talking about. Then I have done my research and I think I know enough about the basics of the treatment. So I would like to share to people that might interested in. And this is not related to my work, and this is my personal interest. So, and this is not medical advice. So if you interested in testosterone treatment or you suspect that you might have low testosterone, please talk to your doctor. And today I would like to talk about what is testosterone and how does it function, what is low testosterone and how can we treat it, what are side effects of testosterone, and what can we do to improve our testosterone without medication. So let's get going. So first, what is testosterone? Testosterone is a sex hormone that is predominantly in men. Female also have this hormone, but is far less. Its function is to produce muscle growth and muscle strength along with bone growth and bone strength. It helps you produce your red blood cells and helps your moods like concentration and motivation, and also your sexual function like your libido and your erection as well. So there are multiple functions of testosterone. How can we produce it? So testosterone is produced by testes. So this is a two oval-shaped organ that sometimes we call it balls. Normally people have two testes. And how can we control it? So the brain will control the secretion of testes. So there is a centrally deep location in the brain, we call it hypothalamus. The hypothalamus will secrete the hormone called GnRH or gonadotropin releasing hormone. So the GnRH will be secreted into the structure below it, which is the pituitary gland. The pituitary gland will produce another two hormones, namely FSH, follicle stimulating hormone, and LH, luteinizing hormone. The main one that controls testes would be LH. So the LH will be secreted into your bloodstream, and at your testes there will be LH receptors, and after they sense it, testes will produce testosterone. So there are three layers from above to below, which we call hypothalamus pituitary gonadal axis. And we also have a system that controls your testosterone level in your body, which we call negative feedback. How it works is that when your testosterone is high, your hypothalamus will sense it and produce less GnRH. And in contrary, if your testosterone level is low, your hypothalamus will also sense it and produce more GnRH to stabilize your testosterone level. That is, we control our testosterone level in your body. And that is how we control our testosterone level in our body. And then how can it get into the low level? So there are multiple causes to cause low testosterone, including the defect at birth or congenital defect or chromosomal defect. So, but today I would like to focus on the low testosterone in adults. So unlike men, women have condition called menopause. So at that time, ovaries stop working and stop producing estrogen. And as a consequence, the woman will experience some symptoms like flushing and irritability, and also they stop having their periods. But in men, the process is very gradual, so it means that it slightly decreases over time. So usually most of the men will not experience these symptoms. The age around gonadal that gradually decline would be around 50 to 80s. But if you experience symptoms, it can be somewhat specific, like loss of your libido, loss of your erection, or somewhat unspecific, like depression, irritability, loss of concentration, loss of memory, loss of energy, and low vitality. And it also can cause other things like anemia, which is your body produce less red blood cells, and you can experience that you cannot gain your muscle after you work out, and also your bone become more fragile, or we call it osteoporosis. And how can we detect it? So we can detect it by your blood test. So the tests that we usually do are total testosterone level. That normal people usually have more than 300 nanogram per deciliter, but some institutions or some kits can use other numbers like 250 or 260. It depends on the test. And then when you're going to have a test, we usually recommend patients to come around 8 to 11 a.m. in the morning, because testosterone has diurnal variation. It means that it has a peak level around in the morning, and it declines during the day. So we would like you to take a test at the peak, usually around, like I said, 8 to 11 a.m. And you would be advised to be fasted, because food and glucose will suppress your testosterone secretion. And also you should not be sick, because if you got sick, it can decrease your testosterone level. So you should be your normal self. And we recommend to take a test 2 times for more accuracy, because of the variation that I mentioned. Besides the total testosterone, your doctors might recommend to test with SHBG and free testosterone. So SHBG stands for sex hormone binding globulin. So let me explain what is it. So for total testosterone, like 100%. So with your total testosterone 100%, the sex hormone binding globulin will bind to your testosterone. We take about 40%. This bond is really strong, which means it rarely break to allow your testosterone to work. And about 40% would bind to albumin, which is weakly bound. It sometimes can get you free testosterone from it. So the active one would be free testosterone would be 0.5 to 3%. So the active substance that work is usually free testosterone. But why don't we measure free testosterone? Because it takes a lot of time and process and cost to measure it, and it has some variation. So usually we don't routinely measure free testosterone, but in some circumstances, like if you have a little low testosterone, or just just lower end of your normal range, you can make the test. So there are some conditions that could increase or decrease your SHBG. So for the decreased SHBG, hypothyroid, that your thyroid function less, obesity, diabetes, some substance like steroid, progestin, and androgen. This could cause your SHBG to be low and could cause your testosterone to be abnormally low. On the other hand, increased SHBG can cause by hyperthyroidism. It means that your thyroid function higher than normal, and aging, anticonvulsive drugs. This can cause your SHBG to be high. So if you have fixable cause, you should correct it, and it can resume your SHBG to be normal. So that is probably the reason. And other than that, you can measure your hematocrit or the red blood cell volume in your body. So this test is used before the testosterone treatment, because if you receive the treatment, it can make your red blood cell more higher or thicker. That may cause some problems. So we call this condition polycythemia if you have a lot of red blood cell in your body. And why is that? Because if you have like thick red blood cell, it can easily clot, and if the clots go to your brain or your heart, it can cause a lot of problems. So that is what we concern. Next would be the PSA, or prostate specific antigen. So this test is used to screen prostate cancer. Why we test it? Because there's some concern by experts that exogenous testosterone could cause prostate cancer. And why is that? Because prostate cancer cells have a lot of androgen receptor, which is receptor for testosterone. And when we treat prostate cancer, we usually give medication to suppress prostate testosterone from testes, or you can surgically cut your testes. So this is used to treat hormone-sensitive prostate cancer. And there may be some correlation between testosterone and prostate cancer, but there is no evidence that if you inject testosterone or you use exogenous testosterone, it will cause more cancer from the research. So this is a precaution of screening only. And then I would like to talk about side effects. So I think the most concerned one would be the loss of sperm count, or if you want to have a kid, you should not use testosterone, because the exogenous testosterone could cause your testes to function less. So it means that it produces less testosterone and it produces less sperm. And also along with the volume, your testes would likely to shrink if you receive testosterone exogenously. So this might sound confused for some people, because your testes, if it produces testosterone internally, it can also help the sperm production. But if you inject the testosterone from the outside, it would cause your testes to function less. So next would be the increased production of red blood cell. It can cause the, like we talked earlier, the polycythemia. We can increase your chance of blood clot in your body. And then we have the testosterone effect, which is quite common. Like it may cause you to be bald because androgen receptor at your scalp, it will cause your hair follicle to stop working. But in contrary, at your face, the androgen receptor would stimulate the hair follicle growth, so it makes you grow more beard. And so the baldness is really related to genetic. So it very vary on between people. Other than that would be acne, because testosterone increase the sebaceous gland function. OSA, or obstructive sleep apnea. So this is the condition that you stop breathing while you're sleeping, and testosterone could worsen that because of multiple mechanisms, like it reduce the contraction of your airway muscle. It means that your airway may collapse easily, and testosterone increase your metabolism, and it makes your body require more oxygen. And then testosterone also make your body to less ventilate when hypoxia happens. So that all in all, it make your OSA worse. So what do we do after the first treatment? So for initially, we usually evaluate around 3 to 6 months after the first treatment. So what to measure is total testosterone, like we mentioned. So usually you should boost your testosterone like a quite amount that different from the starting point, and then you evaluate the symptom. So if your testosterone is normal and your symptom improve, so I think this is the good sign. But if your testosterone is normal but you still have your symptom, so this might indicate that your symptom could be from something else. Like I said, sometimes you got non-specific symptoms. It could be from other diseases. And then after your blood level is good, is stable, you can take longer time to check, like 6 to 12 months. And along the line of that, you should receive hematocrit and PSA tests at each visit. And then what about the normal people that want to increase the muscle growth? So there is actually a study with normal people that receive testosterone versus placebo, and it actually increased the muscle strength and along with the muscle mass. But there are a lot of side effects as well, that like we said, the loss of sperm count, the acne, the baldness. So maybe you have to consider it before you're receiving the treatment. And also, if you receive the treatment for a long time, if you stop using it, it will cause some withdrawal symptoms. So usually it takes time for your testes to produce their own testosterone again after you receive, like especially if you receive long-term exogenous testosterone. So you may experience some symptoms like flushing or irritability if you abruptly stop the testosterone treatment. So in like adults that the testosterone function like degrades, usually we recommend to take like a long-term treatment. And lastly would be the lifestyle modification, that what can we do to improve our testosterone? First is to exercise. So there are a lot of studies about the ways that you can exercise, like endurance training, like running, or resistance training like weightlifting. So both can improve your testosterone, but there are like one study that compare between resistance training and endurance training, and it showed that resistance training could increase the testosterone level more, and they focus on the large muscle like chest, like back or thigh. So this is the large muscle that you should focus if you want to improve testosterone, and maybe you may prefer the weight training. And then would be sleep. So if you sleep deprived, you would have low testosterone, so you should sleep like adequately. Normally people need 7 to 9 hours for sleep. And then like obesity, so if you are obese, losing weight can increase your testosterone. Then I would like to talk about the diet. So first, testosterone is produced from cholesterol, that is fat. So we would recommend eating enough fat. So the low fat diet would decrease your testosterone. And also with calories, so you should eat enough calories for your maintenance body and your activity. If you are in calorie deficit state or you're losing weight, you might experience low testosterone. And then would be some vitamins. So I think vitamin D, zinc, and magnesium could associate with testosterone level. If these three things are low, you should take supplement, and you can take tests at the hospital. And I think that is all for today. I hope you find something useful and maybe interesting. And if you have any question or comments, please feel free to write down at the comment section. And I think thank you for watching. See you in the next video.